Today I'm showing you 5 DIY massage techniques to relieve hip pain during pregnancy. Hi, my name is Sophie and I'm a pelvic health physiotherapist specialized in maternity care. And through my online coaching program, I support moms-to-be from all over the world to prepare their pelvis for an easy delivery and recovery. So if that's something you're into, I invite you to apply on a free discovery call with me in the description below so we can see if we're a fit to work together. All you will need for these techniques is a firm massage ball the size of a tennis ball. You want it firm enough so you can't squish it all the way down, but it should also have a little bit of a give to it when you press on it. For example, you don't want to use like a lacrosse ball or something like that because they're quite hard, and I find that the body just responds by tensing more with those kinds of ball. You also want a smooth surface, not anything with like spikes, because we want to be comfortable enough so we can ease into the tension instead of tensing against it. Personally, if you can afford good quality massage balls like the Yoga Tune-Up here, they are my favorite ones because first, they don't roll away from you because they have kind of that sticky material, but also they will just last longer, right? And you're welcome to use a tennis ball as well. I think that's something that people have on hand a lot of the time, but they may not last as well and they may roll away from you as you're trying to massage. So I would recommend the Yoga Tune-Up ones if that's something you'll do in the long term. The first two techniques are going to address the gluteus maximus, which is the largest and most powerful hip muscle. It attaches all along the sacrum bone and connects right onto the femur. So our first technique, we will go on the wall and place your ball just beside your sacrum. If you're not sure where your sacrum is, you can just simply identify where your tailbone is at the top of your butt crack, and that is the bottom part of your sacrum. So it's kind of a triangular bone here that's just on top of your butt crack, and you want to go just beside that along the edge where the gluteus maximus connects. So move up and down with your ball just beside the sacrum. And to modify the pressure, you can bring your feet farther from the wall or closer for less pressure. So that's how you're going to gauge what is the most comfortable for you. We don't want to create any pain, any discomfort. It should feel good. So find that right pressure to make sure that you're easing into it, that you're letting go of the tensions, and that you're not tensing against the ball. For our second technique, we will massage our gluteus maximus across the butt cheek all the way to the insertion on the femur. So I like to separate it into 3 areas. We're going to massage the top, the middle, and the bottom area. So massaging the top lane a few times from the sacrum to the hip bone, and then moving your ball a little lower to your middle lane when you've done a few lanes on the top. And then finally doing the bottom one. Our third technique will address the piriformis muscle. The piriformis is a small little muscle, much smaller than the gluteus maximus, and it's an external hip rotator. Super important hip stabilizer, and it's also part of our pelvic floor muscles, which is why I have a crush on it. So like the gluteus maximus, the piriformis starts from the sacrum, but it connects on top of the femur head. And an important aspect of that muscle is that the sciatic nerve goes right underneath. So when it's very tight, it can cause sciatica symptoms and kind of nerve pain down the leg. And by the way, I do have a video about sciatica in pregnancy and a few exercises to help with that. So check it out. I'll put it in the description below if you have issues with that. In order to massage the piriformis, we will have to go on our back and put our foot on the opposite knee to expose it and put it into slight tension. If going on your back causes you symptoms during pregnancy like dizziness, short of breath, nausea, I will show a modification with a foam roller in a little bit. But for now, I want you to roll on your sacrum all the way to the top of your hip bone. Now here's a version with the foam roller. So you're going to simply sit on your foam roller with your hands behind you for support, and you're going to put, say if you want to massage your right piriformis, you're going to put your right foot onto your left knee, and then you're going to massage in between the sacrum and the hip bone. I like to put a little more weight on my right bum cheek to really kind of work the muscle. But if it's too much for you, just keep your weight a little more in the middle. Technique number 4, we will go and massage the quadratus lumborum, which connects the lower back vertebrae to the iliac crest near the spine. For those who may experience lower back pain along with hip pain, that would be a good one to massage. So we'll go back on the wall for that one, and you're going to massage just along the spine of the lower back, all the way until the hip bone, and go back and forth lengthwise. Our last technique will be for gluteus medius. This muscle is much more located on the side of our hip compared to our glute maximus, and it's responsible for this movement here. It works as a hip stabilizer like the piriformis, and in pregnancy, this muscle works super hard to stabilize your hips and your pelvis as your growing baby is putting much more demand on your hips. We will work on the wall again for that one, and making small circles with your ball in between the hip crest and the hip bone right here. So you just want to work on the muscle, not directly on the bones. Just small circles. And again, you can adjust where your feet are compared to the wall if you want more or less pressure. Really making sure that we're not causing any pain or that we're tensing against the ball, right? So you want to find that ease. I recommend doing these techniques on both hips if you have pain on both sides, or just on the side that feels like more uncomfortable. And you can do them once a day or less, depending on the amount of pain you're experiencing. I'd say for maintenance, maybe doing 3 to 4 times a week. But if you're in an acute phase where, things are really hard, really challenging, you may want to do it once or twice a day. I hope these techniques were helpful, and again, if you're interested in working with me in my online coaching program, I hope to chat with you soon over a free discovery call. You can apply in the description below. Thanks for watching.